Hello, Assalamu alaikum. We are going to talk about some topics in very simple terms as it's meant for non-medicals. First, we will be talking about diabetes. What's diabetes? It's basically an increase in the blood sugar level above the normal levels. At this stage, I would like to highlight two more things about diabetes. One, it's a disease for a lifetime, and second thing, it requires continuous monitoring and treatment. Basically, there are two types of diabetes. Type 1 is the juvenile onset occurring below 16 years. It's uncommon. It's because of insulin deficiency and it requires insulin for survival.
When our body is working normally, the foods we eat containing proteins, fats, and carbohydrates are broken down into simpler, easily absorbed nutrients. One of the carbohydrates is a form of simple sugar called glucose. It is the main source of energy for the body's cells.
The much more commoner is the type 2 diabetes which you see in adults. It's called maturity onset diabetes and it's due to insulin resistance, meaning thereby that the insulin is not effective, not working properly. Overweight and family history are the main risk factors. So if you see a person, an aged person with overweight and with a family history of diabetes, the chances of developing diabetes are very high. Ethnicity wise, South Asian people, Middle East, African people are more prone. Babies born to mothers who have gestational diabetes, they are more prone to develop diabetes. A sedentary lifestyle makes you more prone to develop diabetes. Talking about the prevalence is really alarming or scary, as you might say. Today there are around 250 million diabetics worldwide, and by 2030, that's in the next 20 years, it's expected to rise 380 million. The incidence in the kingdom itself is put at around 40%. Now the question comes, why does the blood sugar rise? We have to understand one thing. Food that we eat, the sugar from this, the glucose, it is transported from the blood to the cells by insulin, or you might say insulin is a transporter. So when the transporter is not working properly, the sugar, it would accumulate in the blood, and which is seen in the test as raised blood sugar. Meantime, the same pathology, it would explain the symptoms of diabetes. What are the symptoms? Weakness. There is weakness because the cells are starving for energy. Meantime, because the cells don't get that source of energy, they turn to other sources for energy, which results in fat breakdown, and this is how you get weight loss. The excess sugar, it draws out water into the urine, and this leads to excess urination and thirst. These are the early symptoms, common symptoms. Untreated later, you get symptoms which are because of complications. And complications, there are two types mainly: macrovascular, microvascular. Microvascular meaning the big blood vessels are affected. Normally, there is a process called as atherosclerosis where cholesterol and other substances, they get deposited in the blood vessel. Now this process, it is accelerated or it is much more advanced in diabetics. And depending on where the big blood vessel is affected, you will get diseases accordingly. So if the blood vessel of the heart is affected, you will get a heart attack, and if the blood vessel of the brain is affected, you will get a paralysis or a stroke, as it is medically called. Microvascular complications, they mainly affect the retina or the eyes, the kidney and the nerves. Now before we get into the complications, one thing I would like to highlight at this stage is diabetes, by the time it is detected, it's already present in the body for some time. And secondly, many a time, patients are not serious about the treatment for quite some time. So many a times it so happens that rather than coming with the early symptoms, patients, they present with complications. And the most common complication that you see clinically is diabetic neuropathy. So what happens when the nerves are affected? The classical thing is that burning feet syndrome. That is, you start getting burning in the feet. Additionally, you can get tingling and numbness. Later on, the dreaded complications like non-healing wounds, gangrene, etc. occur. Diabetic retinopathy, it typically causes blurred vision, blind spots, etc. initially, and later on it leads to untreatable blindness. Nephropathy, initially, if it is not picked up, it results in renal failure. So here, rather than symptoms, we have to hamper or keep all the onus on preventing the whole thing. Coming to the diagnosis of diabetes, traditionally the method of diagnosis is by doing a blood sugar level, so that if you have a fasting above 110 mg percentage or a PP of more than 140 mg percentage, then that is diagnostic of diabetes. Of late, over the last few years, there is another test called as HbA1c or the glycosylated hemoglobin. This test, it will give you an average blood sugar for the last 3 months, and HbA1c above 7% is diagnostic. This test is also used to see the efficacy of treatment. Other tests that are to be done periodically for a diabetic are a lipid profile, creatinine, ECG, urine for albuminuria, etc. Coming to the treatment of diabetes, it's supposed to be a tripod arrangement, which basically means diet, exercise and drugs. Diet and exercise, they are clubbed together. Medically, they are called as lifestyle modifications. What do you mean by it? It basically means you change the way of living. Essentially, it involves diet and exercise. Meantime, you also stop smoking, you target a weight loss. About the diet, it's a big and unnecessarily confused aspect. You avoid sugar, avoid alcohol, take a low-fat diet, take plenty of salads, and if you are on treatment, be sure that you eat on time to avoid hypoglycemia. Exercises, it's supposed to be about 150 minutes of exercise in a week. And the best thing is a brisk walk for 30 minutes daily. Take care of your feet to avoid bones. If diet and exercise don't suffice to control, then a patient requires medicines, and these are advised by the doctor. The tablets, they are called as oral hypoglycemic agents. The first to be used is metformin, glucophage or monazimab, it is called. Davanil, Amaryl, Piogenovir are other drugs that are used. About insulin, it is not required in the first place in majority onset diabetes. Like I said, it's required in type 1 diabetics for survival. In type 2 diabetics, it is required in few conditions like during pregnancy, during surgery, when a patient gets a heart attack. However, newer studies, they suggest that using low dose of small basal insulin at bedtime, it would avoid complications of diabetes. And I would like to highlight one more thing, that the new insulin pens, they are very easy to use and almost painless. Monitoring of the blood sugar by the patient itself by a glucometer, one touch, is highly advisable. Some additional information, other risk factors like hypertension, cholesterol, previous heart attack, they should be treated also. And about pregnancy with diabetes, it is risky for both the mother and the fetus, and it requires very stringent control throughout pregnancy. Patients on treatment should also be aware of the symptoms and the treatment of hypoglycemia. So what happens with hypoglycemia? The blood sugar goes down, so that you would get hunger, thirst, sweating, palpitations and other things. Best thing, take any smart sugar that is available at that stage. So in conclusion, I again repeat that diabetes is a cognizable disease for a lifetime. It requires continuous monitoring with the aim to prevent the feared complications over the period of time. Yet, as I keep saying to all my patients, if D is for diabetes, make D for discipline. Keep diabetes under control, look forward to a fuller, healthier life.
Atherosclerosis is the buildup of fatty deposits, including cholesterol, in the walls of arteries. It's a major cause of cardiovascular disease, including stroke and heart attack, and contributes to the death of around 70 million people worldwide every year. This short presentation illustrates the key stages in its development and its main impact on cardiovascular health. Cholesterol is a natural, fat-like substance and is essential to health. However, too much cholesterol in your blood can be harmful. Cholesterol is produced in the liver, but can also be found in certain foods, such as those high in saturated fats. There are many types of cholesterol. The main type involved in atherosclerosis is called LDL-C, or bad cholesterol. Another type of cholesterol, HDL-C, is called good cholesterol.
What's cholesterol? It's a soft, fat-like waxy substance present in the body, and it's required for the functioning of the cell membranes and for some hormone production. Hypercholesterolemia, dyslipidemia, hyperlipidemia are terms which denote an increase in the cholesterol level above the normal levels. Talking about the sources of cholesterol, this has to be understood. 80% of the cholesterol is synthesized in the body itself by the liver, and only around 20 to 25% is derived from the food. What are the food sources? It's mainly meat, eggs, dairy products, this so-called fast foods like pizza, burgers and other things. So what will a high cholesterol do? A high cholesterol, it will get deposited inside the blood vessel and it will form a hard plaque-like substance, and it will make the artery narrow and less flexible. This process is called atherosclerosis. If on an atherosclerotic plaque or a clot forms, then that blood vessel, it will get blocked, and depending on where the block is, If it is in the heart, you will get a heart attack, and if it is in the brain, you will get a stroke or a paralysis. There's one more thing. There are basically 4 types of cholesterol. Many times people say ki, I have done my cholesterol, but only cholesterol alone is not important. When they say only cholesterol, you mean total cholesterol. There are basically 4 types of cholesterol: total cholesterol, HDL cholesterol, LDL cholesterol, and triglycerides. And the test which denotes all this test together is called lipid profile. It should be done preferably, and it's to be done preferably over 12 hours fasting. Why we need all these subtypes? Because these different cholesterols, they have different importance, and that's the reason why a lipid profile is much more preferable than over a simple cholesterol. Of these cholesterols, HDL cholesterol is the good cholesterol. Total cholesterol, and more importantly LDL cholesterol, is the bad cholesterol. Triglycerides is not important from the cardiac perspective. So now, when should we check for cholesterol? Men above 35 and women above 45 should get that cholesterol checked regularly. People with family history of hyperlipidemia, heart disease, diabetes, hypertension, smokers, obese people, people with sedentary lifestyle, they should be prompted for getting a cholesterol checkup done. Coming to the treatment of cholesterol, again, like I have said in diabetes, it's supposed to be a tripod arrangement. You have lifestyle modifications comprising of the exercise and diet on one hand, and medicines on the other hand. Lifestyle modifications we have already dealt with. It means exercising regularly. And about the diet, there are few details we would like to get into. There should be few habits which we should cultivate. Like when we take food packages, we should check the nutrition level to find out the amount of cholesterol and the calories from the fat consumed. Fats are basically comprised of saturated, monounsaturated or polyunsaturated fats. Saturated fats are the bad fats, and they are mainly found in animal products like red meat, eggs, etc. Plant products generally contain unsaturated fats, and they do not contain cholesterol. So if you take a diet that is rich in plant products, especially in whole grains, beans, seeds, vegetable, fruits, it's good. And you avoid saturated fatty acids, in the sense meat, eggs, dairy products, and cooking in animal oil. If diet and exercise do not suffice, then your doctor might advise you medicines. And the main category of medicine that's used is called statins. Some popular names here are Lipitor, Vasta, Sincor, etc. A passing reference about fish oil and cholesterol. The American Heart Association has shown that fish oil is supposed to be good for the heart. So if you take fishes which are like salmon and sardines, they are preferable, and they will protect you from heart problems. It decreases the triglycerides and increases, more importantly, the HDL cholesterol. Cholesterol, my dear friends, is called a silent killer. Why is it called a silent killer? Because cholesterol per se by itself does not give rise to any symptoms. People say like cholesterol has given me this pain over here, this thing over here. It is no such thing. Cholesterol, as we have seen, it will block the arteries, and it will straightway give rise to those dreaded diseases, heart attacks and paralysis. That's the reason why cholesterol is called the silent killer. And we should look out for this, and we should get it under control. And as per the American Heart Association, for each 1% decrease in cholesterol, there is a 2% decrease in heart disease. So lower your cholesterol and prolong your life.
Do you know if you have high blood pressure? Find out how you can prevent or control it. High blood pressure, when left untreated, can damage the blood vessels in your body. It hardens the arteries as cholesterol and calcium builds up. Over time, the arteries narrow, restricting blood flow and damaging critical organs like the heart, brain, eyes, and kidneys. The first sign of high blood pressure affecting the heart is the thickening of the heart muscle. It now struggles to pump blood into the circulatory system through narrowing arteries. Left untreated, the condition worsens, and all this time you do not feel any symptoms. Over time, high blood pressure further narrows the arteries, cutting off blood to the heart. When your arteries become critically narrow, or if a piece of the blockage breaks off, it may result in a heart attack. A heart attack can cause permanent damage to the heart muscle by affecting its ability to pump blood, resulting in heart failure. High blood pressure is a leading cause of kidney failure. Damaged blood vessels in your kidney affect its ability to filter and clean blood. Left untreated, the kidney will eventually fail and dialysis or a kidney transplant will be needed. In your eyes, high blood pressure can affect the tiny arteries of the retina. Bleeding and blockage can result in blurred or lost vision. When arteries harden in the brain, you can suffer a stroke that damages brain tissue. Some arteries may rupture, causing bleeding or hemorrhage. This can result in slurred speech, paralysis, and loss of consciousness.
Hypertension or increased blood pressure. Blood pressure is basically the pressure that's exerted by the heart on the blood vessels so that blood gets pumped to the body. 40 by 90 mmHg, it is called hypertension. The upper reading is called systolic and the lower reading is called diastolic BP. It can be mild, moderate or severe hypertension based on the reading. One more thing I would like to clarify at this level is that readings between 120 by 80 mmHg and 140 by 90 mmHg, they are now categorized as pre-hypertension, which means at this level there are chances of a person getting hypertension over the period of time. How does hypertension happen? 95% of the cases, bulk of the cases, they are called primary hypertension or essential hypertension, meaning thereby that there is no apparent reason for hypertension to happen. With aging, hardening of the arteries happens. This is one factor that has been incriminated. A high salt intake and some genetic factors are also involved. Of the remaining 5% cases, they are because of secondary causes and they are due to diseases of the adrenals, of the kidneys or the aorta. Talking about the symptoms of hypertension, it is very important to highlight that hypertension can be totally asymptomatic. There have been instances where the blood pressure has gone even up to 300 mmHg without the person having any symptoms. About the symptoms, the most common is hypertension. That leads to the detection of hypertension. Breathlessness, nausea, giddiness, chest discomfort, blurred vision are additional symptoms caused by hypertension. The important thing is understanding the complications that are caused by hypertension. Long-standing hypertension, it gives rise to what is called as end organ damage. And which are the organs which are damaged? It's mainly the heart, the brain, kidneys and the retina. If the heart is affected, it gives rise to heart attacks and failure. If the brain is affected, it gives rise to stroke or hemorrhages. And if the kidney is affected, you get renal failure. When the eyes are affected, you get retinopathy and maybe vision loss. This is why hypertension is categorized as a major illness. How do you diagnose hypertension? It is simple. It is diagnosed by measuring your blood pressure standardly on a mercury sphygmomanometer as you see over here. Electronic apparatus are available. The ones which are available in the market at cheap rates, they are not reliable and I would advise not to use them. It's preferably not to use them. For assessing the end organ damage, additional tests are to be done. For assessing the heart, ECG, echo, TMT will be done. For the kidney, renal function tests like creatinine, urea, ultrasound for the kidney size, and fundoscopy for the eyes. These are the tests that are done. Coming to the treatment of hypertension, basic is lifestyle modification as discussed earlier. So you're talking of exercise on one hand and the same type. About diet, you reduce the salt intake. If the pressure is still high in spite of lifestyle modification, then drugs are to be used. These drugs, your doctor would decide. There are different categories, mainly alpha blockers, beta blockers, calcium channel blockers, diuretics. Which drug, when to use, it has to be decided based on the age, the ethnicity, the other associated illnesses, and other associated findings on tests and other things. Which drug to be used, that the doctor would decide. Some popular names of antihypertensives that are used are Amlor, Concor, Capoten, etc. Important take-home message, friends, is that treatment is to be continued lifelong. Prevention, how do you prevent? You exercise regularly and you decrease the salt intake.
this heart is pumping properly, moving oxygen-rich blood to every part of the body. Down the center, we see one of the coronary arteries, which supplies blood to the muscles of the heart itself. A heart attack is caused when one of the coronary arteries is blocked. For instance, inside this coronary artery, a cholesterol plaque has formed. Platelets and red blood cells collect on the rough surface of that plaque, building a clot which will eventually block the artery. Once the artery is completely blocked, it no longer supplies oxygen to certain parts of the heart muscle. The lack of oxygen damages the heart muscle. The damaged muscle can't pump properly, causing a heart attack.
Coming to our next topic, that's heart attacks, or myocardial infarction as it is called. What does it mean? It simply means the blood vessels that are supplying blood to the muscle of the heart, they get blocked. Why does it get blocked? It's blocked because of a process called as atherosclerosis, wherein cholesterol and other substances, they get deposited in the blood vessel and they block the blood vessel. Now, when on top of this plaque, atherosclerotic plaque, a blood clot forms, it totally occludes the blood vessel and a heart attack results. There are different grades, like there is something called as angina on one hand, which is treated on an OPD basis and a person is moving around, versus a complete myocardial infarction, where a person needs to be admitted in an ICU and treated, and that too the earliest possible time, without any delay. What are the risk factors for developing a heart attack? Smoking, diabetes, hypertension, raised cholesterol, increasing age, family history, stress, sedentary lifestyle. These are all the main risk factors. Talking about the symptoms, the classical is a left-sided chest pain which radiates to the left arm and the person feels restless, uneasy. Besides this happens in 70% of the cases. Besides this, there are some other symptoms that can also present for the same disease. What are that? Breathlessness, profuse sweating, chest discomfort, chest constriction, heaviness on the chest, marked uneasiness, jaw pain, etc. Why are we afraid of heart attacks? We are afraid because the complications are very bad. Irregular rhythm or irregular heart rate or a bad pumping, it can end up with what is called as a cardiac arrest. What is a cardiac arrest? It basically means the heart stops functioning, it stops beating. And averagely, if the heart stops beating, it has to restart in 3 minutes. And this is almost next to impossible except if the person is in a proper ICU. That's the reason why heart attacks are feared, because of the risk of life-threatening complications which can end up in cardiac arrest. So the main life-threatening complications are irregular pulse or arrhythmia and heart failure. How do you make the diagnosis of heart attack? It's mainly done based on an ECG and supported by enzymes. This is what happens in the acute phase. Otherwise, there are other tests which are done periodically depending on the patient's condition, and these tests are echo, treadmill, angiography, etc. Each test has its own importance. Echo will tell you the heart muscle status, treadmill will tell you the functioning, like how much load the heart can take, and angiography will tell you the vessel status or the amount of blocks that are there. So if a person has got acute myocardial infarction or a severe heart attack, what is to be done? Prima facie, first come first. First come first, you seek immediate medical advice by activating EMS number 997 in Saudi or rushing to a nearby medical center. There is a golden hour period of 3 hours wherein the person should avail of treatment. The reason being, most of the deaths they occur in the first hour of heart attack. So this golden hour period, it has to be very important. You should not say, okay, I'll rest for some time, I'll do this, or give me some treatment for the time being. It's better you go to a medical center, assess, and if the severity is severe, there are many new drugs which are used, especially thrombolytic drugs. And if they are given at an early stage, the chances of death or mortality, they are very low. Meanwhile, the person, he should be asked to lie down and relax. If available, give him an aspirin tablet to chew and a nitrate tablet under the tongue. Treatment in the ICU, it is done by an intensivist or the cardiologist. As far as angiography is concerned, if there are too many blocks seen on angiography, this is done at a later stage, then angioplasty or a bypass surgery will be required. How do you prevent heart attacks? Well, lifestyle modification is the key to prevention. Regular exercise, diet, mainly low-fat diet, stress management. Risk factors like smoking, diabetes, hypertension, high cholesterol, etc., they should be tackled. Stop smoking. Take treatment as per your doctor's advice. And before I finish, for patients who have already sustained a heart attack previously, they should always be on maintenance treatment, and this treatment is important to avoid. It is important to avoid a second heart attack. And some drugs which are used in this context are baby aspirin, Concor, etc. Coming to the next topic, that is gastritis and ulcer.
Food enters the body through the mouth, then travels down the esophagus and into the stomach. The stomach produces acid and an enzyme called pepsin, which aids in digestion. The stomach lining is protected from digestive acids by a thin layer of mucus. Sometimes, an imbalance between the pepsin and stomach acids can develop. When this happens, an ulcer can form. An ulcer is a sore that develops on the lining of the stomach. Symptoms of gastric ulcer can include abdominal pain that occurs after a meal, nausea, vomiting, weight loss, and fatigue. Some gastric ulcers can be caused by infection with a bacterium called Helicobacter pylori. This bacteria exists in the stomach and can change the mucus layer that protects the lining from digestive acids. Cigarette smoking, foods, and beverages containing caffeine, alcohol use, and certain medications may contribute to the development of gastric ulcers.
What does it mean? It basically means damage to the inner lining of the food pipe. As you may not appreciate it so much. Somewhere down here you will find the food pipe, or the pipe that leads into the stomach. This is the stomach per se, and the outlet part of it is called duodenum. So if there is damage to the inner lining of the food pipe, the stomach, or the duodenum, this is called gastritis and ulcer. When the damage is superficial, it is called gastritis, and when it is deep, it is called ulcer. Normally, when food reaches the stomach, the acid is released to break down the food into smaller particles, and then subsequently these particles are submitted for further digestion. However, if the inner lining of the stomach is damaged, the acid secreted, it will irritate the wound and cause symptoms of acidity. Why do you get gastritis? The main culprit by and large is supposed to be food. Spicy foods, overeating, sleeping immediately after eating, beverages, alcohol, these are supposed to be the risk factors which make you prone for developing acidity. Additionally, smoking, painkiller medications like Brufen, etc., overweight, pregnancy, they are factors which cause ulcers. Over the last few years, H. pylori, a bacterial cause of ulcers, has been recognized, especially in most patients of DU, and it's an infective cause of gastritis which is treated with antibiotics. There is one popular slogan as far as gastritis and ulcer is concerned. It is hurry, curry and worry causing these diseases. Hurry is a mental hurry or anxiety which is perpetually there. Curry and worry. So these things together, in short, are causes of gastritis. What are the symptoms? You get burning in the chest or in the abdomen. You get abdominal pain. You get nausea, vomiting, fullness, giddiness, etc. At this stage, there is one thing that needs to be highlighted. A duodenal ulcer versus a gastric ulcer. A duodenal ulcer, it would cause relief of symptoms on eating. It gets worsened on empty stomach. Whereas a gastric ulcer, it will cause worsening of symptoms after eating. What are the complications of ulcer and gastritis? You can get bleeding in the vomiting, which is called hematemesis. You can get perforation, and there can be outlet obstruction. Coming to the treatment, it would again start with food. You avoid spices, take more of cold milk, eat in small amounts frequently rather than eating too much at a time, and avoid lying down for half an hour to 1 hour after eating. Medicines are to be used if food alone does not help. Antacids are simple drugs which give you symptomatic relief by neutralizing the acid's effect. However, it won't heal the wound or the ulcer. The main treatment for healing, it is done by a group of drugs which are called as proton pump inhibitors. Popular names are Omes, Nexium, etc. H2 blockers such as famotidine are also used but less frequently. H. pylori, it is treated with antibiotics and in a type that is called as triple therapy. Surgery nowadays is not usually required if treated properly and completely. However, if there is a severe outlet obstruction or perforation, then surgery will be required.
program shows how to handle various emergencies that may arise at home, work, or play. To recognize and treat injuries such as deadly external and internal bleeding. The viewer will also learn first aid for wounds such as cuts, scrapes, bruises, infection, impaled object, amputation, and nosebleed. For minor and major burns caused by heat, chemical, electrical, and by the sun.
Injuries they are sustained commonly outdoors while working or while playing. Important cause in Saudi, in the kingdom, is RTA or the road traffic accidents. Domestic injuries like burns, etc. They are caused in the house itself mostly. There are also other domestic injuries like trivial fall in the bathroom, cut by knife, etc. Patients, they come to the medical facility because of pain and bleeding. Normally patients do some self-treatment for domestic injuries and report to the doctor when there are complications. However, it's advisable that patient reports to a doctor after initial first aid. About the injuries, one thing which needs to be told is that many times you will find a simple bleed, and on the other hand sometimes you will find a bleed where the blood is almost jumping out like a fountain. The chances are that this injury, it could be because of an arterial cut, and in this case you should rush to the hospital as early as possible. Now for a bleeding source, there is a formula called as 3 Ps, that is position, packing and pressure, and these will control most of the bleeding wounds. Tying a tourniquet mostly on extremities, it can stop bleeding, but however it should not be done routinely. For superficial wounds, you clean with soap and water initially, then cover with a clean cloth and report to a medical facility. Some injuries, you need to have some precautions. If the neck or the spine is involved, then immobilization is very important, and more so in polytrauma patients. During transportation of such a patient, immobilization can be done by putting a sandbag on either side of the head. If the patient is vomiting, this vomit, it can be aspirated and it can lead to bad complications. So the person, they should be nursed sideways, and any secretions, they should be cleared. Some caution has to be exercised in some places. Like you should know probably when a head injury is to be suspected. This is to be suspected if there is wound on the head, there is profuse vomiting, altered consciousness, bleeding from the ears or nose, fits, etc. On the other hand, if the patient looks very pale, then there is a strong possibility of internal injury, internal bleeding, especially from vital organs like the liver and spleen, in which case rush such a person to a medical center immediately. Coming to burns, there are different types of burns, but the most common is burns from fire, and it may vary from minor to serious burns. Domestic burns are usually due to hot liquids, and it results in what is called as scalding, wherein you get big vesicles. Industrial work-related burns can be complex, and there can be associated polytraumas also. Severity of burns, it is judged by percentage and the depth. Percentage is the percentage of the body surface area that is involved, and depth ranges from 1st degree to 3rd degree burns. Generally, adults with more than 50% body surface area involved, they require hospitalization for intravenous fluids and other treatment. Immediate first aid is to evacuate the person from the source of burns. Some important tips. If there can be choking from smoke, soot and inhalation of fumes from the burning material, and this causes a great degree of morbidity because it ends up with carbon monoxide poisoning. In such case, the person should be evacuated to an open space first, and reassurance to allay panic is equally important. What is the first aid? The best first aid is to pour running water or immerse the part in water. This will clean, and at the same time it will decrease the temperature of the burned area. Then wrap it in a clean cloth and report to a medical facility. In case of an active electrical current, water cannot be poured till the patient has been isolated from the current. Treatment of burns. You rush them to a nearby medical center. Mild and superficial burns, they can be treated on OPD basis, but they should be supervised closely for any further deterioration. Severe burns, the treatment is in hospital. It needs meticulous treatment and patience. Death is mainly due to infections and kidney failure. Plastic surgery is to be considered at a later stage. Thank you.